So I have a question. You're both drinking wonderful Hawaiian Island water
Warm.
and warm. Yeah, sorry.
Cool down.
But
Just plain.
we have our friends in Flint, Michigan, who have been ingesting lead-laced
Lead.
water. And so, what would you predict the future of some of those infants, at least during important developmental stages with their brains, and the effects of that lead? I mean, what could we realistically predict in 10, 15, 20 years?
Well, we have a pretty good idea of the lead impacts on brain development, and that's definitely intellectual deficit. We know that, learning difficulties. But I would be more concerned about the steroid, the synthetic steroid that's in this plastic bottle, and what the impact of that is with the plastics in our world in terms of the change in the estrogen levels, synthetic estrogen, that is affecting the mass biology of the planet. I'd want to look at that,
I think you're asking an extremely
Important.
important question, and that question really, I think, is much larger than about lead. I think it's the question of what information do we have that needs to be looked at, and what information don't we have? For instance, I'll give you two live examples that happened in the 90s, not so long ago. Mid-90s. The American Medical Association announced that they had done the World Health Organization had done a research study, and they went to the most far out places on the planet that were as far away from all sorts of contaminants. And what they found was that mercury was found in the testicular system of the males around the planet. In the most remote regions, and that what they could guarantee was that there would be a reduction in the productivity and the likelihood of healthy children from those males. And these were males that were, for instance, going north all the way up in the Inuits, all the way up as far north as you can go, and into the most far remote regions you could imagine that should have had no exposure, and they were showing a enormous quantity of exposure, that of mercury, and that mercury has far-reaching impacts on the chemistry of the chromosomes. That was preferred, it was recommended to the physicians that information not go public.
at the time.
At that time. A second thing that took place, and this never went public, so this is something you would have to question me on, and you'd have to push into to find the actual research, which is in Western New York in the Research Institute for Addictions next to Roswell Hospital in Buffalo, New York. This happened in about 95, 97. There was a research study that was done on children that were born from, I think it was a study of about 500 or 1,000 people. And the pregnancies, the questions were things like, how many of you planned for the pregnancy? How many of you had so much to drink the night of, the likelihood of the fertilization? And then they went and they studied it for both men and women and went back as far as 4 weeks. And what they found was that anybody who had more than males in particular, this is an extremely unusual finding, males who had more than 4 drinks the night of fertilization would produce detriment. In other words,
Some measurable fetal
there
alcohol
would be
impact.
a likelihood of fetal alcohol impact that was definitely measurable, observable, and I was fortunate enough to actually see a wall about the size of this of nothing but the pictures of the brain development of all of those fetuses over the months. And in every case, not one case, was there not distortion.
See, and this brings us back to the general idea
This
of
was
what is trauma.
considered to be
Yeah.
too controversial
Yeah, to let out.
to let out.
But this brings us back to the idea of what is trauma and what is biological origins of human neurology behavior. You know, I mean, is fetal alcohol syndrome trauma? We don't consider it trauma, but chemically, is it not a trauma to the fetus to be exposed to alcohol? Of course it is. But we don't consider that trauma. Do you see what I'm saying? You know, we don't consider that. We don't consider epigenetic factors, you know, the expression, the impact on gene expression based on social environment. We don't really look at that as trauma. We don't look at that
We
as,
don't
as
look
a social
at,
impact.
and we don't look at men's drinking and what they're carrying, and that what they said from that was is that for that not only was it for that weekend, but it was for that whole 2-week period. If they didn't have anything more to drink, but they exceeded the limit of 4 drinks. 4 drinks.
So wouldn't that be like 90% of the population?
It certainly would be.
Drink, you know,
That's-
when you have
which is
sex
why
and
it-
Which is, and
Yeah.
it also, yes, and it
Oh,
supports,
goodness.
and it supports the idea that, in fact, we have more unplanned pregnancies than we do have planned pregnancies.
And more fetal
And we
alcohol
have
impacts.
more fetal damage than we want to admit
Absolutely.
I always
socially.
understood it as the mother being.
I know,
Everybody
that's what was so
understood that.
radical.
The fa-
That's what was so radical about
Yeah.
this finding.
Yeah.
Is that it was the first time
Yeah.
that they absolutely, without a doubt, found that it was the male sperm that was damaged by the alcohol
Yeah.
and continued for 2 full weeks.
So I-
They swept this under the rug.
It was not published. It was considered to be not published.
Too controversial.
It was not, it was never published. It was put into the archives.